managing fatigue. So hopefully some practical things. And before we think about proactively what we can do to increase our energy, let's not forget about the parts that Professor Koenig mentioned about. We're made of many parts, and any problems with these other parts can exacerbate your fatigue. So it's very important to remember your heart and remember your lungs. So the heart is a muscle as well. When you have mitochondrial myopathy, for specific conditions, it can affect the heart. And as you can see, fatigue is also listed as a problem with, for example, heart failure. Then for those of you who might have mitochondrial myopathy and particularly more neck flexion weakness, it can often be associated with respiratory muscle weakness. So in terms of respiratory muscle weakness, it can be cause a type 1, what we call a type 1 type of failure, where you can't get enough oxygen into the blood, which is not good for someone in the longer run. But the more problematic short-term one is when the body doesn't get enough kind of energy to get rid actually of the carbon dioxide. And if acutely someone retains this, then a person can become very fatigued and sleepy. The other issue that might happen in older adults is if they have postural hypotension. It may or may not be related to the heart. It may be related also to a neuropathy. If you have that and you have low blood pressure, there are ways of managing that to correct that. Besides the heart and lungs, these are things that you can relatively easily test for in your blood tests. So we've talked about diabetes and also thyroid disease. You can see for diabetes, whether it's too high or too low with the sugar can cause fatigue. And we know that there are specific, many different management options for both acute illness and chronically in managing the sugar level. In terms of hypothyroidism, it can also cause fatigue and lethargy. So when we check the blood tests, we also check for things like anemia, because if you don't have enough red blood cell, you can't have enough cells to carry around the oxygenation. And iron studies, just to check whether you've got enough iron, because both of those can be replaced. We can also check for kidney and liver function, because certain mitochondrial disease can be associated with kidney manifestation. And if that hasn't been checked recently, then go back to your GP to have those checked. But more rarely, when someone suddenly has an exacerbation of weakness or of fatigue, you should be checking and looking for things like infection, the common things such as upper respiratory infection or urinary tract infection, because treating those might improve the fatigue. And then for those of us who might get a little bit more older, there are relative cancer screens that we should not forget when we're just concentrating on the mitochondrial disease. So more relevant to the rest of us as well is sleep. So sleep hygiene is often something that we discuss. For some of us, we might actually have to rest and have to nap throughout the day to get enough energy to do things. But for some of us, it might be just checking the checklist that we kind of have optimized our chances of having a good night's sleep. So those include, do we have a consistent sleep schedule? Are we trying to wake up about the same time each day and sleep about the same time? Are we limiting the amount of caffeine, particularly later in the day? And don't forget about the alcohol and also the nicotine, because it is a stimulant. Exercise is relevant for those who can actually exercise, because if you exercise during the day, then there's greater likelihood that you will feel tired enough to sleep overnight. Are we keeping the sleep environment quiet and dark, or are we turning on our iPads and iPhones in the middle of the night, going on YouTube and Facebook, which will stimulate you? And then it's also interesting that there is a condition called, I think, orthosomnia. It was actually mentioned in one of the TED Talks that people can get so worried about not being able to sleep that the anxiety itself causes them not to be able to sleep. So if you actually can't sleep a particular night, don't worry. If you can't sleep 8 hours tonight, you sleep 4 hours, it averages out. So instead of checking the time, oh no, it's 3 o'clock and I still can't sleep, don't worry about it. Just try to sleep, relax. And then for those who do have a dysmotility and then, bowel, slow working guts, then it's best to avoid large meals near bedtime. Now we talk about more the medical conditions related to sleep. So some of us could have trouble with sleep apnea, both central or obstructive. And there are very effective treatments in the form of, the CPAP machine for people who snore. Something similar like bilevel ventilation can be helpful with those who have severe kind of respiratory muscle weakness. So for someone who has neck flexion weakness or known to have some respiratory muscle weakness, it'll be important if there's an exacerbation of fatigue that we check, has the respiratory function been checked in the last year? If there's still further concern, like if you wake up and you don't feel refreshed, you might have a headache, etc., then you might have to consider a sleep study with your physician. Now we come to the part of psychology. Do not underestimate what it can do to fatigue and your everyday life. Depression and anxiety is a very common occurrence in the normal population. And I lead you to 3 websites, some of them you already know, regarding the Black Dot Institute and Beyond Blue. But I'll also show you the mindspot.org.au kind of website. These websites talks through and has free online information and assessments for those who are just wondering, I feel very fatigued, I feel okay, but I'm not sure if I'm actually depressed or anxious. Is there something I can do about it? So the K10 is one of those shorter kind of questionnaires of 10 questions to check whether you are likely to be affected by either, anxiety or depression. And in terms of MindSpot, for example, it has online assessments that you can do that will give you a report later on. It has online courses that you can do at your own pace over a 6-week to 10-week period, which addresses issues such as anxiety or depression, chronic pain that might be relevant for some of us, chronic physical health conditions, and also for those without mitochondrial condition, but might be the carers in terms of well-being overall. So do address this thing, look into it, or help your relative to look into this, because improving this can improve fatigue and improve a person's well-being. Now, these things are medications. So medications are things that are used to treat. You can also cause fatigue. We'll know about sleeping pills. It helps you sleep, but it might leave you with an overhang effect the next day. Allergy medicines, they're better now in terms of things like certain medication are non-drowsy, but they're also the drowsy ones. So if you're trying to unblock your nose, just check there's not an ingredient to make you more sleepy. Painkillers such as codeine, endone, tramadol, those can cause sleepiness in patients. And also neuropathic pain type of medication can also cause drowsiness and fatigue. There are the antidepressants that can be used both for mood and for pain, anti-anxiolytics, and I would also just show anti-epileptics. What we're trying to say is not that if it makes you fatigue, you shouldn't take it, but it's the pros and cons. So if you need it to avoid seizures or treat an encephalopathy or stroke-like episode, you might have to put up with the fatigue until things settle, and you can look and talk to your physician about whether the medication can be adjusted. So now we talk about the proactive parts, which is with the exercise therapy. So you often hear about aerobic therapy and strength training. So aerobic is more, you get a bit puff with it, whereas the strength training is more weight-based. So with endurance exercise, the theory is that it might increase the relative proportion of fat oxidation. Whereas with weight training, there's a theory that it might increase the muscle ability to regenerate. It can increase the number of satellite cells, and these are cells that grows into new muscle cells per muscle nucleus, if you will. We often recommend for patients to do exercises or build up their exercises in a graded manner, starting from low intensity, short duration, and building up over time. And the important thing is to listen to your body. So if you're actually sick from something else or extremely tired that day, that's not the time to push yourself, because you can push yourself overboard. Instead, it's when you feel relatively well, you can build up slowly. That is also not to say that high intensity kind of type of exercises is not relevant. But I think if you try those type of exercises, it should be supervised by someone on a regular basis. We do know that compliance is an issue in terms of, say, 100 patients we ask, maybe less than a handful of patients will be able to stick to their regimen. And for those who actually stick with them, they actually tend to do well. So in terms of aerobic exercises, those that make you puff, most of the studies involve the subjects doing it at least 3 to 4 times a week, because you need that regularity to help you build up the exercise tolerance. And mostly they recommend about 70% of the maximum heart rate. And the way you count your heart rate, the maximum heart rate, is subtract your age from 220. So say if you're 30-year-old, the maximum heart rate for you will be 190. And if you try to exercise to a heart rate of about 130 should be what you're targeting for. So that's a heart rate where you can talk in sentences, but not in a whole paragraph. And you should feel a little bit puffed. As opposed to resistant exercises, so weight-bearing type of exercises is very talked about 1 repetition maximum, which just means, say for the biceps, exactly how many kilograms you can lift. Say if it's 10, for example, then you aim to repeat the exercises. Say you do 10 repetitions, instead of 10 kilograms, you do say 2 kilograms, because you want to not want to push yourself too much. But keep in mind, you still have to do it regularly 3 times a week for the benefit. So after exercising, the other thing that we can do is activity pacing. So activity pacing is aimed at avoiding the extremes for different people. So some people, because of their fatigue, might avoid doing activity because they know they will end up being fatigued. So as a result, they have very low level of activity and moderate severe fatigue that's ongoing. On the opposite side, you've got people who might feel better on a certain days because I'm so fatigued on all the other days, I will do everything I can on today. Except then they are extremely fatigued for the rest of the week, if not for 2 weeks. And then as a result, they have severe fatigue and prolonged inactivity afterwards. So pacing yourself, it means by dividing the daily activities into smaller, more manageable portions. And the aim is to improve the activity level over time and overall, whilst decreasing the physical activity variability so that it's more even, so that you can predict and kind of plan things a little bit better. So pacing also involves goal setting. So the idea is you set a baseline. So say if you normally walk for about 500 meters, then you kind of track how long it takes you and how far it is that you walk. Do you walk twice a week or do you walk 3 times a week? And keep a record, because if you don't keep a record, you don't know how you're going. Then I'll show you in the next slide about repeating the daily tasks. Instead of doing, say, 500 meters, if you want to do it repetitively and avoid fatigue, you say you walk only 400 meters instead. And then you write down the things that you do. So the aim is do small bits often and break the activities into smaller chunks. So if you have to vacuum and do the dishwashing, you just do one first, and then you ask someone else to do it, or you do the vacuuming the next day. And if vacuuming the whole house is too much, you vacuum one room at a time. And you also have to take regular planned relaxation periods. The aim is for people over time. If you're more severely affected, it might mean it takes a month or 2 months. If you're less affected, maybe a week will do. Then you increase the activity slowly by 10%. So instead of walking 500 meters, say you walk 550 meters, etc. So as such, you build up your activity level according to what's called the SMART goals, which is a goal that are sustainable, meaningful, achievable, realistic, and timed. And don't worry, there's a website actually by WA Health that you can look into for more information. So this is one of the PACE activity sheet. If you can look at this person, the suggestion is this person normally walks for 30 minutes and then the next day 25 minutes and then the third day 35 minutes. But instead of following this level, they reduce it by 20%, and as such, they walk for just 24 minutes, say 3 times a week. And then eventually, after a month or after 2 months, they increase it by just a little bit, 10%, 2.5 minutes. And hopefully with that and with the rest that's kind of factored in, they're able over a long time to do a little bit more. So I won't spend too much time talking about medication or supplements, because we have heard that there's actually not enough evidence for individual one of them to say that they necessarily help. As Professor Koenig has suggested, we suggest patients to try it for about 12 weeks, have something objective to measure, like the distance you walk or what you can do, so that you know at the end of 12 weeks whether it's working or whether it's not, so that you don't keep spending money on something that may not be helpful.